Hey guys, how you doing? It's Dr. Ganatra, author of Reinventing Dentistry and creator of Dental Practice Mastery, where we teach you how to build, market, and grow your practice. Well, it's the end of the week. I'm almost done with the workday here. I wanted to shoot you this quick video. This is specifically for you if you're a new grad or if you're in dental school right now, or maybe you've been practicing for just a year or two. I've gotten a lot of comments on our Facebook page here and feedback through email. And I really wanted to make this quick kind of 5-10 minute video for you. I don't know how long it's gonna go. But I got 3 things in my mind that I wanna share with you that I really want you to kind of take into consideration, and hopefully it gives you a perspective on how to make sure that we're helping you be successful in your path and career and journey as a dentist. I graduated 13 years ago now, and 3 practices later, and our mentorship program and all that. And I love connecting with dentists out there, and I feel like we're so blessed to be part of such a wonderful career and a beautiful path in order to help serve our patients. So let's just get right into it. There's 3 areas that if you're in dental school, or if you're graduating coming up, or you just graduated not too long ago, focus on these 3 things. I promise if you do that, it will really springboard your path to success to a whole new level. Let's just jump right into it, okay? It's been a long day, like I said, just got done with a bunch of patients. So the first thing is this. Number 1, make sure you put a priority on making your patients feel understood, more so than them just understanding you. Obviously, they got to understand you. They got to kind of get the logic behind what you're saying and the emotional component behind what you're saying. But more important than that is, can you make your patients feel like, hey, the doctor gets me. He or she, they get it. They get me. They should feel understood. When your patients feel understood, a whole new platform opens up for you. This whole new arena of trust, loyalty, connection opens up. If you can make your patient in the chair feel like you get them, like you make them feel like, hey, you know what, I get you. You make them feel understood. Now they're going to start on more treatment. They're going to be directed into the path that you want them to go to. I'm assuming that it's a sincere, it's a good path. And also, they're going to be wanting to kind of come back and connect with you and be in your practice and be part of your, healthcare team. So that's a really important part of it. Make them feel like, hey, Dr. So-and-so, they just get it. They get me. And most of the time when I see a new patient, the last thing I do is talk about their teeth. The first thing I do is connect with them, make them feel like I get it, and I know where they're coming from, what's important to them, right? So that's really important. I can go on and on about that, but I want to get to number 2. The second thing is, if you're just coming out and you're looking for a job, or maybe you're working somewhere, or maybe you're going to be graduating soon, or maybe you're in dental school, the second thing is this. Don't focus on the money, focus on the growth. And I know it may be easy for me to say this 13 years out, but when I first started, I was making less than the hygienist. The hygienist was making, I definitely know that she was making $50 more than me per day, and I was making less than the hygienist. And looking back at it, I would have worked at that practice for free. I would have done it for free. And the only reason I can say that now is because I learned so much, and I found 2 of my mentors back then through working there. And I learned a ton from these people. And that knowledge, that growth, really helped shape my projection forward. It really helped me build my first practice, my second, and my third. All of that came from the growth that I got from those first few years out of dental school, right? So focus on the growth, not the money. Yes, you can look at a couple different job offers and say, hey, I'm gonna get this much here, I'm gonna make this much here, or I'm gonna go there. And I know there's student loans, totally get that, I totally get that. But if you can find a happy medium where you're focusing on growth and not just money, especially when you first start out, you're going to serve the most important part of this whole equation, which is you. You're going to serve yourself at a much higher level, at a much more impactful level, because now everything that you're soaking up that first year out of school, and you're going to see that the first year out of dental school, you'll probably learn way more in volumes than you probably did in all of dental school. Not to say that you're not going to learn a great amount in dental school, but you will pick up so much, and that's why it's very important to focus on the growth aspect of it, okay, and not just the money. Let me add something else here as well. When I say growth, I don't want you to think about dentistry. Dentistry is something you're a dentist, so it's going to be on your mind, but your weakness coming out of school isn't the fact that you don't know how to place implants, or maybe you don't know how to do osseous surgery as well, or maybe you haven't prepped a 10-unit veneer case, or maybe you haven't done any gingival grafts. That's not your biggest weakness. As much as you may think the clinical side is the weakness, that's not it. The weakness or the handicap lies in the fact that you haven't been out in the world. You haven't been out in the real world, kind of exposed to clinical dentistry outside of school. And you know what? We were all there, myself included. So if you just take that little pause in your life when you graduate and say, hey, you know what? I'm going to focus on how do I grow? How do I serve myself here while serving my patients and really understanding not just clinical dentistry, but the business of how dentistry is done. And business is not a bad word. Business, the concept of business enables us to make a profit so we can further make an impact on our patients and those around us, right? So we can't perpetuate the motion forward of a practice unless we can make a healthy profit and actually contribute and give back to our community, right? So you want to make sure you do both. The focus on the dentistry part, clinically, but that's not your weakness. Don't think that's your handicap. The area that you really should zone in on is, how is this practice run? How do the patients come in? How do I understand insurances, HMOs, PPOs? What happens to the follow-up after a patient leaves a practice? How does that work? What happens to what we put down in the charts? How do we reach out to the patients through this new technology we have? How do we use social media and online marketing to really create a platform for our business? So focus on those things. Don't think that since you just graduated that stuff is beyond you, or you should not learn the business of it. Don't be one of those dentists that's just heads down and thinking about drilling, okay? I promise you're gonna get the clinical skills, you're gonna get them, and you're gonna be even better next year than you are this year. And that still could apply to myself, 13 years out, right? So clinically, that's going to come. But the growth aspect, that's not automatic. It has to happen intentionally. Have that intention behind it. Third, without harping too much on that, make sure if you're applying for a job, or if you're switching practices, or you're an associate at one office and you're going to another office, make sure that you don't just send out your resumes. You know what? I found my best opportunities and my best jobs or associateships by just walking into the practice that I thought I'd want to be at. So if I was living here, I just walk into there. So wherever you are in the world, walk into the practice, introduce yourself, be personal about it. Because if the owner thinks, wow, this person's really personal about him introducing himself to us, and of course he's going to treat our patients well. So go in there and be very interpersonal. Just go in there and meet the person who you want to meet. Don't send out a resume. Most dentists are so busy reading through a ton of resumes. At the end of their day, they saw 15, 20 patients. That's the last thing they probably want to do. So be different. Walk into the practice, make sure you look professional, make sure you have an idea about where you want to go, where you've been, and what you can kind of say to that person to make them feel confident in your ability, not just as a clinician, but more importantly, as a person, okay? So walk into those practices that you want to be at. Just pinpoint them, say, I want to go there, I would love to work there. Just walk in, introduce yourself. That's the best way to do it, guys. I hope this helped, and I hope it wasn't too scattered everywhere, but these are 3 things that, we've gotten a lot of questions on, what's the next step? Where do I start? What do I do? These areas are areas that you really should zone in on, whether you're in school, out of school, you've been practicing for a year or 2. You know what? I know that focusing on these 3 things will definitely serve you. I hope you enjoyed the video, and if you want more tips and more guidance on this and direction, check out the book, Reinventing Dentistry. We're #1 on Amazon for it. And also, if you want to dive in even deeper, join one of our monthly coaching programs, monthly mentorship programs. You can do that online as well. So until then, I will see you in the next video. I'm going to jet out. It's a beautiful day out today in sunny Orange County, California. I'm going to go enjoy the day, and thanks for watching. I will see you in the next one.